Hey, you are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss how glaucoma can increase pressure and it can damage the optic nerve and lead to vision loss with our expert Dr. Tina Damani, who is a senior consultant ophthalmologist who has experience of more than 15 years in the field of ophthalmology and glaucoma. She works as a joint medical director and consultant at Chaitram Netralaya, Indore, which is one of the largest tertiary eye care hospitals in central India. It is a high-volume center where 25 to 30,000 surgeries are performed every year in all subspecialties of ophthalmology by a team of skilled doctors. Hello Dr. Tina, welcome to our podcast for patients, caregivers and healthcare professionals at Medica Talk. Doctor, can you tell us what glaucoma is?
Glaucoma is a group of eye diseases usually caused due to high pressure inside the eye, resulting in damage to the optic nerve. This optic nerve is like a cable which connects the eye to the brain. So if there is damage to this optic nerve or this cable, signals from eye won't reach the brain, resulting in loss of sight. Unfortunately, the damage due to glaucoma is irreversible, and this disease is the leading cause of irreversible blindness in the world.
What causes glaucoma?
There is constant production of water-like liquid called aqueous humor inside the eye. Normally, as new liquid is produced in the eye, a constant amount of same liquid should drain out through mesh-like structure called trabecular meshwork. This trabecular meshwork is present in drainage angle, which is located between cornea and colored part of the eye called iris. This balance of inflow and outflow of the liquid is very important to keep stable pressure inside the eye. But if this drainage angle is not functioning properly, fluid will build up inside the eye and result in high pressure inside, and this high pressure damages the optic nerve.
What are the risk factors of glaucoma?
A number of risk factors are associated with glaucoma. We have already discussed that high pressure inside the eye can lead to glaucoma. Elderly patients, patients with family history of glaucoma, patients with thin cornea, patients who have been using corticosteroid medications for long, those who have had previous multiple surgeries in the eye or had eye injury, patients with health conditions like diabetes, hypertension, patients who have myopia or hypermetropia are also associated with specific types of glaucoma. So all these people are at a greater risk of developing glaucoma and they should be followed up more closely.
What are the types of glaucoma?
There are different types of glaucoma. Some are primary, in which there is no other eye condition involved. It can be open angle or closed angle. Some are secondary glaucomas, where there is some other eye condition or some identifiable cause which has led to increased pressure inside the eye. It could be trauma, previous surgeries, corticosteroid use, inflammation in the eye, and a lot more reasons. Then there is congenital or developmental glaucoma, that is glaucoma occurring in babies or in children. This occurs when there is incorrect or incomplete development of drainage canal of the eye.
How is closed angle glaucoma caused?
You might be aware that the part of the eye which is responsible for its color is called iris. Sometimes this iris is pushed forward inside the eye in such a way that it closes the drainage angle. See, you can imagine it as a piece of paper sliding over a sink drain. Once the drainage of aqueous is hampered, pressure inside the eye rises, and this pressure rise leads to damage to the optic nerve. Rarely, this increased pressure is sudden. That is, it presents in acute form with a lot of pain and headache, vomiting, etc. And this is a medical emergency. Most often, this pressure rise is gradual and causes no pain, that is chronic form of angle closure glaucoma. Other than the risk factors that I have previously mentioned, farsightedness or hyperopes, they are more prone to develop this subset of glaucoma.
How is open angle glaucoma caused?
Primary open angle glaucoma is a very common type of glaucoma that we see in our OPD. This happens when there is a lot of resistance to drainage of aqueous humor at the level of trabecular meshwork. Even though the drainage angle is open, it is just like a clogged drain. So if fluid cannot drain out properly, obviously the pressure inside will build up and again there will be damage to the optic nerve.
How is low tension glaucoma caused?
Low tension glaucoma is also called normal tension glaucoma. It is a form of open angle glaucoma where optic nerve gets damaged even when pressure inside the eye is within normal range. Research is still going on to find out exact cause of this type of glaucoma. It is believed that factors which are not related to eye pressure may play a large role in development of low tension or normal tension glaucoma. It could be due to structural weakness of the optic nerve itself or due to abnormal blood flow to the optic nerve. What we know at present is that elderly people, people with migraine, those who develop cold hand and feet, people with low blood pressure, those who have sleep apnea syndrome, they may be at a greater risk of developing normal tension glaucoma.
How is pigmentary glaucoma caused?
As I've already mentioned, that colored part of the eye is called iris. So in patients who develop this type of glaucoma, what happens is that lot of pigments are released due to rubbing of back of iris surface with part of lens. These pigments, they go and clog the drainage system of the eye and then they cause increase in pressure. So it is a type of secondary glaucoma because we know what the cause is. It is found more often in young males who are myopes or nearsighted.
What are the usual symptoms of glaucoma?
Glaucoma is called silent thief of eyesight. Unfortunately, most glaucoma patients have no symptoms. You could actually lose 50-60% or even more of your optic nerve without noticing any problem. Glaucoma affects peripheral or side vision initially. So most patients, they do not realize they have glaucoma till either the central vision is affected or they are left with tunnel vision. And by this time, glaucoma is already in its advanced stage. There are some forms of glaucoma like acute angle closure glaucoma which can present with pain, redness, headache, halos around light. But in general, most glaucoma patients have no symptoms.
How is glaucoma diagnosed?
The only way to diagnose glaucoma is complete eye examination. Glaucoma screening that checks only eye pressure is not enough. Glaucoma is diagnosed by measuring intraocular pressure using tonometer, doing gonioscopy to see if drainage angle is open or closed, doing a thorough optic nerve assessment using slit lamp biomicroscopy, getting visual field test done. This visual field test is also called perimetry and it is done to check for missing areas of vision. We also look for structural damage to optic nerve by using machines such as OCT.
Can progression of glaucoma be stopped? What are the treatments after the diagnosis?
We know that damage caused by glaucoma is permanent, but early treatment can most often stop further damage and protect your vision. So, aim of treatment is to decrease the pressure inside the eye, and this can be achieved by medication, laser, surgery, or a combination of these three. Medications may be prescribed in the form of eye drops. These drops need to be instilled daily at regular interval as advised by your ophthalmologist and preferably at the same time every day. Depending on the type of glaucoma, laser procedure may be advised to you. This can be in the form of trabeculoplasty or iridotomy. Glaucoma surgery, what actually is done in glaucoma surgery is that a drainage channel is created for the aqueous humor to leave the eye so that the pressure inside the eye gets decreased. So surgery can be in the form of trabeculectomy or tube implantation or the newer minimally invasive glaucoma surgeries. These surgeries can be combined with cataract surgery also.
Could you suggest lifestyle modification for glaucoma patients?
So once you've been diagnosed to have glaucoma, you need not change your activities much. You can continue with most routine activities. Some activities are known to raise eye pressure and these should be avoided. For example, drink only a glass of water at a time, not a liter in the morning. Avoid breath holding exercises, weight lifting, or tight clothing around the neck, like don't wear tight neckties. Some activities can actually lower the intraocular pressure and are good for glaucoma patients, like aerobic exercises, yoga, meditation. If you're practicing yoga, please avoid headstand or Shirshasana, downward facing dog, legs up the wall, standing forward bends.
Doctor, what message would you like to give to our listeners?
I would like to emphasize a few points in the end. Anyone can get glaucoma. So please do not think that my vision is normal and I need not go for eye checkups. I repeat, anyone can get glaucoma. It is important to have regular eye examinations, especially after 40 years of age, to pick up the disease in the initial stages only. If you are at a risk of glaucoma, please go for regular eye checkups. What we need to understand is that glaucoma, if recognized early, the progression can be slowed or prevented. So there is no need to panic. If you have glaucoma, you will need treatment and you will need regular monitoring for the rest of your life. Thank you.
Thank you, Doctor, for being a part of Medica Talks and sharing your insights on risk factors of glaucoma and its causes. We are hopeful that the insights shared by you will help many to take the right steps at the right time.
Hey listeners, I hope this podcast was beneficial for you. Don't forget to stay tuned with us for our next podcast session, where we bring to